Analytical study design. Exposure is not assigned by the investigator in the following study design. In the cohort, case control, and cross sectional, the exposure is not assigned. Cohort study, it is not suitable for diseases with a long latency period. Laws to follow can introduce bias also. But better suited to demonstrate temporal association between exposure and disease, that obviously that is cohort. Okay. Relative risk more than one indicator is incidence is in exposure is higher than the unexposed. If odds of exposure among cases is lower than the odds of exposure among the control, the odds ratio will be less than 1. All babies born in a particular year will form a birth cohort. True. Cohort study is suitable for rare disease. No. Cohort study is not suitable for rare disease. Appropriate cohort case control study appropriate for study for rare outcome, less time consuming than cohort study. Multiple exposure can be examined, relatively less expensive compared to cohort study. Appropriate measure of statistical association cohort study is risk ratio. The entire population of a given community is screened, and all those judged as being free of colon cancer are questioned extensively about their diet. These people are then followed up for several years to see whether their eating habits will predict their risk of developing colon cancer. This is an example of, obviously this is a prospective study, cohort study. Exposure is assigned by the investigator in which of the following, obviously experiment. When a group of people with a defined characteristic and followed up to determine incidence is known as a cohort. Relative risk is a ratio. Next is a relative risk of one in a cohort study indicate incidence and exposure and unexposed group are same. The women aged above 35 years were screened for the HPV infection, and those who had HPV infection were then followed for several years to predict the risk of developing several. This study is known as a prospective cohort. Which of the following is appropriate regarding a cohort study? That is appropriate for studying of rare exposure, expensive and time consuming. Expensive and time consuming cohort study. Okay. So the following statement regarding the cohort study is false. Suitable to study with a long latency period. That is false statement. Laws to follow up can introduce bias. Yes. Relative risk can be calculated in a cohort study. Yes. Temporal association with a risk factor can be established. Odds ratio more than one indicated. Odds of exposure among cases higher than the odd of exposure among the controls. If there is a comparison between epidemiological study and analytical study. Okay. Which of the following statement about case control and cohort study is correct? Cohort study establishes a temporal association. To determine the associated factors of antihypertensive drug compliance, and investigator selected 384 participants with hypertension who were undergoing treatment in a tertiary care hospital. The investigator collected details on the socio-economic background of the participant, took a history regarding the consumption of the medicine in the past 2 weeks. Then the drug complaint and the non-complaint group were compared to identify the factors of the drug complaint. That is case control study, gynecological research, and an investigator conducted a case control study with the psoriasis patients cases and other skin diseases patients as a control. Those who are having hypertension were considered as exposed, and non-hypertension were non-exposed. The study found an odds ratio of 1.45. Psoriasis is positively associated with the hypertension. That is 1 point. A prospective study was conducted to determine association between coffee consumption and the risk of pancreatitis and 10,000 healthy participants. Among the participants, 3,005 participants consumed coffee, whereas 6,500 participants did not. After a follow-up of 10 years, 85% consumption of pancreatitis, where among the non-coffee consumption and the relative risk. All of the following are elements of a cohort study. It involves a calculation of incidence rate as produced from exposure to outcome. It involves follow-up of the participant. All of the following are limitations of case-controlled study. You can introduce recall biases. Incidence of disease cannot be determined. Yes. Selection of appropriate control group may be difficult. Yes. You can introduce attribution bias. No. Using medical records from a tertiary care cancer hospital. A researcher collected data on occupation exposure and lung carcinoma on patients admitted between 20,000 and 2010. He classified the patient having history of working in coal mines or exposed and other non-exposed. He then compared the frequency of lung carcinoma among the exposed and unexposed. That is a retrospective cohort study. A pediatrician recruited 120 children with Crohn's disease and their matching siblings controls. The research to collect a history of exclusive breastfeeding from the mother presence and absence of EBF. Exclusive breastfeeding was compared between the diseased and non-diseased children. Identify the study, that is case control study. Okay, case control study. About which is the following is incorrect about the selection of cases in a case control study. Selection of cases should be based on the exposure strategy is an incorrect statement. Cases of studying participants who are the disease in the source population. Inclusion of prevalent cases can be save time and money. Inclusion of prevalent case may introduce service bias. Next is a multi-centric study was conducted to determine the association between diabetes and cataract. Investigator recruited 1,000 diabetes and 2,500 non-diabetes. Participants were examined to exclude the presence of cataract at the time of recruitment. They were followed once yearly for 10 years to document development of cataract. The study found that the incidence of cataract among diabetic patients was more compared to non-diabetic in the study design. That is prospective cohort study. Thank you.